Thanks, Damon.
All right, and speaking of the sun, with over 1 million skin cancer cases diagnosed every year in the U.S., it's always a good idea to get checked.
Yeah, and Utah actually has an especially high prevalence of this stuff. Joining us this morning, we have Dr. Jacque Panko to talk about a free cancer screening clinic. Why is it so important to be focusing on this skin cancer stuff now, anyway?
Well, skin cancer is one of the most common cancers among Americans. 1 in 5 people will develop a skin cancer at some point in their lifetime, and 1 in 60 will develop a melanoma, which is the most deadly kind of skin cancer.
Okay, well, we've been talking about skin cancer for a long time now, so why are we seeing the cases increase?
Well, it could be that that there is more tanning bed use. That's one possibility. It could be that we're catching them more early and preventing more serious skin cancers.
What are you supposed to look for on yourself? I mean, if you're doing a self-check, when you're not going to the dermatologist, I mean, what are you looking for?
Well, skin cancers can present as pimples that don't heal, scaly spots that don't heal, or changing or new moles.
Is there, I mean, that seems like I'd be in there every week, possibly.
Yeah.
So
I'm a little ashy right here, a little dry.
Well, that's one of the most important things about going to a skin cancer screening is that you can be educated about what to look for on yourself or your loved ones that would be concerning for skin cancer.
Okay. Are there certain groups of people that are more prone to developing skin cancer?
Well, sure. Anyone that lives in a sunny place like Utah at altitude, and of course people with lighter skin are more susceptible to skin cancer, although skin cancers can appear on people of all skin types.
Okay, and so when you go to the screening, what do you have to do? I mean, do you have to strip down in a big warehouse and everybody's there just filing through, or what do we expect?
We have clinic rooms, and it's just like going to a doctor's appointment, and depending on which kind of skin cancer screening you go to, you can get a full body skin check in private, or if it's in a more public setting, it can just be on your sun exposed areas, your face, arms, hands.
Okay, and then what happens from there? You see a little something, and it doesn't necessarily mean that it's skin cancer, but it's sent off to a lab and
exactly.
Okay. Diagnosed, checked.
Exactly. And at the free skin cancer screening, it's quick, it's easy, it's 10 minutes, and the dermatologist, nurse practitioner, or physician's assistant will recommend that you go see your doctor for a biopsy.
Okay, so here's the information right here. Here's where it is. There's a phone number to call for. Do you have to do it by appointment here?
Nope, you can just show up.
Just show up right here at this address in Murray. And so when do you show up?
We're doing it between 5:30 and 7:30 this Wednesday at the Intermountain Cancer Center.
And the whole key, I guess, is to catch it early, right?
Exactly.
Does that, I mean, it's a very deadly form of cancer if people out there don't know, so...
If you catch it early, skin cancers of most types are treatable.
Yeah, I've had it 3 times now, actually. And so, I mean, if you do catch it, you caught it early, it's no big deal. But if you don't, I guess, pretty serious stuff.
Exactly.
Dr. Panko, thanks for coming in. Appreciate it.
Time right now is 8:39. Do you know